Physical exam. Pulsar paradoxus, classic sign of cardiac tamponade. What does it mean? Here's your definition. Now, in case you actually need it in words, here it is. I would recommend that you are able to interpret the graph that we just saw prior. Quite important, because those are kind of questions and those are type of interpretations that you're responsible for being an effective clinician. Pulsar paradoxus refers to decrease in systolic blood pressure, decrease of more than 10 millimeters mercury with inspiration. There you have it. Why? More blood? Well, we just walked through that in great detail in the previous discussion. Jugular veins will be distended because of restriction. Heart sounds, you tell me about those. Are you able to listen to your heart sounds well? No, you cannot. Muffled. Move on. What about EKG? You have increased effusion and you have thickness within the pericardium. So therefore, when you put an electrode on your heart, how well is that going to measure the voltage? Not very well. Low voltage is what you're looking for. What does that even mean? You take a look at an EKG. What is a voltage? Is that the x-axis or y-axis? Voltage is amplitude. All right, so I need you to think R wave. Can you see it? Close your eyes. R wave. Major positive deflection. And that is going to be reduced. Low voltage because of effusion. Electrical alternans, which are alternating large and small Curious complexes, may be seen. That's important because you don't have the sustained increase in Curious complex consistently because of the increased fluid within the pericardial cavity. That has to be clear. So a couple things that you want to pay attention to in terms of medical terminology so that you understand what's going on with your patient. Chest x-ray, well, it's more important that we take a look at our echo, where you're going to find actual increased fluid within the pericardial cavity. Echo reveals pericardial fluid, collapse of the ventricle during diastole. If without hemodynamic consequences, what does this mean to you? Watchful waiting with treatment, because ultimately, if your patient goes into decompensation, you need to get in there, remove that fluid. And drainage of fluid, what's this called? Pericardiocentesis. What are you doing? You're opening up a window and literally removing that fluid, especially when your patient, pay attention, hemodynamically unstable. Increased risk recurrence may require a pericardial window. And so at some point, remember, steroids and such, sure, Band-Aid therapy, anti-inflammatory. But ultimately, when you have recurrences, your definitive treatment is going to be your pericardial window. And that's exactly what you're seeing here. You will open up a window surgically. You will then literally drain the fluid right out of your pericardial cavity so that you can relieve that pressure ASAP. Why? How would you know that your patient is going into decompensation? There's going to be decreased cardiac output. The blood pressure hypotension is what you're looking for positive JVD. You might be looking for dyspnea. So that means that the heart right now is being majorly handicapped. And so therefore you need to get in there and relieve your patient.